So more details to come. So that's the end of the opening here. I'll pause for a moment and see if we've accumulated any questions in the Q&A function. I'm going to pause. I'm getting a head shake from Megan. But again, you know, as the day moves on and questions come up, and certainly, you know, after the meeting, please reach out for questions about any of these topics. All right, so we are pretty close to being on time. Let's move into the next agenda item. I'm going to welcome in one of the MEDIC team members, Michelle Macy, who all of you know. Michelle's the chair of the Data and Publications Committee, but also co-chairing the Disparities Workgroup, and she's going to talk about that work. Welcome, Michelle.
Thanks, Keith. And it's really great to be able to be here this morning to highlight this important work that we're taking on within MEDIC. We have an interest in understanding disparities within the quality initiatives that stemmed from Blue Cross Blue Shield's interest in addressing social determinants of health, and then the disparities that really became a huge issue as the COVID pandemic evolved. So as that spotlight on disparities and racial inequities came through, we had a lot of questions in the coordinating center, and that led to a lot of ideas, like how can we look at our data to think about disparities and closing gaps in care. And this led us to recognize that we don't internally possess in the coordinating center all the answers. And so it brought us to start a work group on this. And the work group has helped us generate more questions and even more ideas. So we've got tremendous momentum, and we're looking forward to what's going to come from this work. The Disparities Workgroup membership currently consists of clinical champions as well as partners who have expertise in diversity, equity, and inclusion, both from the health system administration level, the clinical care delivery level, and the education level. We have representation from hospital administrators, and this group continues to be open to new membership. So if you or anyone in your site is interested in participating, please email Megan. We have been able to have some fantastic conversations with this group and very productive dynamic meetings where we went through a prioritization exercise to come to some objectives that we're starting to tackle now. We have two short-term objectives that were agreed upon from the group, and the first is looking at a process for standardizing our reporting to see how performance varies across race, ethnicity, sex, and payer. The new registry Tableau reporting feature allows filtering by race, ethnicity, sex, and payer, and so this is going to be something that we're going to be able to visually illustrate very easily. What the data aren't going to be able to tell us is what's going on to explain these differences, but we hope by highlighting differences where they exist, it will motivate sites to think about what could be going on here and start to think through root causes and solutions to close gaps in care. So we'll start to be kind of socializing that presentation of data as we're going through the next few collaborative wide meetings and information sharing, and we want to really be stimulating thought on how this information can be used to understand differences at your own site. The second short-term objective that the group had was to bring in expert speakers on health disparities in emergency medicine and quality improvement. And I think we all recognize that the health disparities area, particularly around racial disparities, is its own field of expertise. And that is the point where we really need to lean on the experts locally and nationally to help us improve our own understanding of how we can address this in a responsible way. So pending schedules that permit, we do have a save the date on Dr. Khaldoon's calendar for October 1st in the collaborative-wide meeting. Special thanks to Seth Krupp and Martina Caldwell for facilitating the introduction and probably being part of the reason why Dr. Khaldoon was willing to accept our invitation. Dr. Khaldoon is a leading expert and prominent in state and national policy, serving as the Chief Medical Executive for the state of Michigan and the Chief Deputy Director for Health in Michigan in the Department of Health and Human Services. She's a part-time practicing physician at Henry Ford Hospital in Detroit and has extensive involvement locally and nationally related to coronavirus and the disparities that are present in that illness. Now, turning to our long-term objectives, first, we recognize a need to really take a deep dive into the data that we have in the registry and better understand how these data are collected, documented, and then how we can appropriately analyze them in a way that we're providing back useful information for sites to improve care. The second long-term objective is really to seek out opportunities for our learners and trainees. And we have a PhD student who's interested in working with us this summer to answer some of these questions around how data are collected and how they're kind of managed through electronic health records. And she has some expertise with large administrative claims experience prior to going into her PhD work at Michigan. And then third is in the space of disseminating information through research and publications. And we're starting with a look at disparities within the Chest X-ray Quality Improvement Initiative. And the Data and Publications Committee is supportive of this work. And then if you have ideas on how you'd be interested in pursuing questions in this space, we would really love to hear from you. And again, Megan's our point of contact, both if you're interested in joining the work group, if you have questions that you'd like to see us try to address using MEDIC data, we really welcome that. The last thing I wanted to just raise everyone's attention to is the academic dialogue around race and ethnicity, and particularly the importance of our ability to understand how those data are collected and then to report them out in a standardized way. And there was an editorial in JAMA in February at the end of the month that lays out some really clear guidance on this, and it's open for public comment because the guidance that they're proposing here is going to go into the AMA citation standards. So if this is something that you're interested in, or you know folks in your local emergency department space or health system space who have academic interest in this space, please have them look to this and provide some public comment. And we'll work to be using these standards as we're presenting our own information. For example, how I led off by explaining that we aren't quite sure how the data are entering into these EMRs that we're then looking at and stratifying our population on. And with that, I am happy to take any questions that come up, and looking forward to collaborating with everybody in this area going forward.
So I'm getting a head shake no from Megan at the moment.
We've got one, sorry.
Oh,
We've got one.
got one
here.
coming in.
Yep.
Yeah, so from Lee Benjamin, can you comment on how statistical significance of the disparities, or are we not there yet as we're starting to recognize the trends? So this is a really great point. And it's something that we need to be looking into. And with some sites and some populations, we end up with a really small sample size and then in turn, really wide confidence intervals. So it's definitely something that we are working to be clear on and make sure that we're presenting information in a way that we can appreciate if those differences are really different or if those differences are subject to small sample size situations.
Any other questions or comments? Megan showing up. Well, it is absolutely important to the coordinating center that we get feedback. So please follow up with us. Take those opportunities like Michelle was outlining here around participation in the ongoing work of the Disparities Workgroup through the Research Publication Enterprise in the Data and Publications Committee. Absolutely. Thanks so much, Michelle. Good to see you again.